Hi to all the Alzheimer's advocates and volunteers who are gathered together. I know many of you, and I want to thank you for the time you're taking to learn more about the issues so you can be most impactful at the state capitol. I'm Susan DeMarois. I'm the director of the California Department of Aging, and this video comes at a really good time. We're wrapping up our second annual Master Plan for Aging report to the legislature. And in that report, we've captured all of our achievements in 2022. For this group, the Alzheimer's Association, I'm proud to say that there are at least 10 achievements I can lift up. And you'll be hearing more on January 24th of next year about where we'll be focusing in the coming legislative session. So, following in David Letterman's style of the top 10 list, the first one is Dementia Care Aware. This was launched in July of this year, and the Alzheimer's Association was instrumental to this $25 million investment focused on early screening and detection. And the work is being carried out by UC San Francisco together with our Department of Healthcare Services. The second on our top 10 list is CalCompass. This was launched in the fall, and the acronym CalCompass stands for the California Community Program for Alzheimer's Services and Supports. This is the new Alzheimer's Daycare Resource Center model, and there's now funding in 7 counties: Orange County, Contra Costa County, Sacramento County, Napa County, Santa Clara County, Butte County, and Los Angeles County. The third on our top 10 list is $10 million to continue the very successful Healthy Brain Initiative in the 6 initial counties: Shasta, Placer, Sacramento, Santa Clara, Los Angeles, and San Diego, and expand the funding beyond those 6 to new counties. Once again, the Alzheimer's Association was key to securing this funding. Number 4 on our top 10 list is launch of the In-Home Supportive Services. We call that IHSS, Career Pathways Training and Stipends Program, with key topics including cognitive impairments and behavioral health and complex physical care needs. Number 5 is the rollout of the Direct Care Workforce Innovation Fund, at least $55 million of a $150 million investment for staff and family caregiver training. Applications are under review now, and many applicants include references to Alzheimer's and dementia. This extends also to training and stipends for workers in all home and community settings. Number 6, a brand new federal grant to test a new Alzheimer's model with area agencies on aging and aging and disability resource connections in Imperial, Ventura, and Marin counties using community health workers as dementia care navigators. Number 7, more than $60 million to shore up all adult day service providers for increased staffing and infection control infrastructure. This will help participants in day programs as well as adult day health care. Also, part of this includes expansions to MSSP, PACE, and the Assisted Living Waiver 2. Number 8, numerous consumer protections, starting with visitation in assisted living and skilled nursing during a public health emergency, adding a new position focused on public guardians, and increasing funding to the long-term care ombudsman program. We've also invested and expanded the state's adult protective services program. Number 9, elimination of the Medi-Cal asset test to enable Medi-Cal eligibility for more Californians who previously were denied due to savings or household equity. Beyond this, more than 250,000 undocumented Californians aged 50 and above are now eligible for full scope Medi-Cal. And last on our list, number 10, nearly $9 million was just awarded for a statewide public awareness campaign focused on risk reduction, especially among populations at greater risk of developing Alzheimer's and dementia, including African Americans, Asian Pacific Islanders, and the Hispanic Latino communities. I'm limiting myself to the top 10, but I assure you there's much, much more that we can talk about. happening in the areas of Alzheimer's, dementia, and family caregiving. I'm honored that you invited me to join you virtually tonight, and I really appreciate the opportunity to share with you the successes happening in California. We are committed at the Department of Aging and in the California Health and Human Services Agency and the entire Newsom administration to deliver results and implement the initiatives that I just mentioned to you. We also look so forward to working with you in the coming year as we start a new legislative session. And we want to hear from the Alzheimer's Association early and often about your priorities. I wish you all a wonderful, safe, and happy holiday, and we look forward to seeing you in 2023.